So for example, a grade 1 injury, typically a few weeks for recovery and return to play. A grade 2 injury could be about a month or 6 weeks, and a grade 3 injury could be more than 6 weeks, depending on how extensive the injury might be. Based on that, the training staff, the medical staff can then provide the appropriate treatment for the athlete so that we're able to allow them to heal and get back to peak performance. The other types of injuries that we see for hamstrings are ones that are at the ischium or in the pelvis, and that's where the hamstring tendons originate. So they start in the pelvis and they go all the way down the leg, and it's really that injury high up in what we call the ischium or the sit bone. Those are the ones that we see that are more extensive in terms of the type of injury. And the problem with those tears is that they usually don't heal. In general, in the summertime, we see a lot of hamstring injuries. We see a lot of water skiers that do water sports. And the problem is that when you're trying to get in a water skiing position and you're getting in that crouched position, as the boat starts to accelerate forward, your hamstrings are the muscles that kind of keep you in that seated position so that you're able to take off once you start to water ski. The problem is that typically, if the boat is moving very quickly, this might cause a rupture to the hamstring. And in most cases, the boat is going to be stronger than your own hamstrings, and this is what leads to these hamstring tears, or you might hear about hamstring avulsions. Traditionally, what we've seen is that when you have a complete tear with more than 2 centimeters of retraction, or if you have 3 tendons that are totally torn, no matter how much of a retraction there is, these are the ones that unfortunately need to be surgically operated.